Welcome to Body and Health Mechanics. This is a corner called Today's Special. In this section, we will be going out into the world and showcasing an expert in their health modality. We will invite them to explain and demonstrate their field of work to give you a better understanding. Questions are always welcome. Now on to the newest portion. Hello and welcome back. I am Kelly from Body and Health Mechanics. On today's special, we're going to be discussing acupuncture. Today, we welcome Nagin, who is a registered acupuncturist, who's going to give us an explanation, answer some frequently asked questions, and do a short demonstration on all things acupuncture. Welcome.
Thank you.
I give the floor to you.
Okay, just as Kelly said, I'm a registered acupuncturist, and when people think about acupuncture, a lot of people think needles, pain, and ouch, that hurts. But honestly, acupuncture has nothing to really do with that, and people need to really get a better understanding of what acupuncture really is. So in a more Western standpoint, which a lot of people are more familiar with, acupuncture is the needling of specific points in the body that activate the nervous system, and that helps with all the benefits it has. Whereas in more of a Eastern holistic approach, acupuncture is the needling of specific points along meridians and specific points to help that with the energetic healing and help to treat the mind, body, and soul. Okay, so I've compiled the most frequently asked questions when it comes to acupuncture and acupuncture treatments. So the most common question that I get asked as an acupuncturist in every treatment is, does acupuncture hurt? Honestly, acupuncture isn't meant to hurt, and you may feel some sensations that are completely normal when it comes to needling, or you may feel nothing. Either or is completely fine. So the common sensations that you may feel are some tingling around the needle, some buzzing sensations, or like an electrical sensation, but it should go away within a few seconds. So that's where we have a fine line. So some points may be more painful than others, depending on what points we're doing, if we're going right into the muscle or if we're just doing a regular acupuncture point on their own. But here's the difference here. If there's a point that the pain or discomfort doesn't dissipate within a few seconds, you let me know and we'll adjust the needle need be, or we'll even take it out. Acupuncture is meant to be relaxing and comfortable. Another common question that's usually asked is, how often should I come in for an acupuncture treatment? So my rule of thumb is always once a week for 5 weeks, just so we can make sure and give the treatment the best shot it takes. Acupuncture is usually looked at as some miracle worker, but again, it's not necessarily. You have to give it a chance, just like going to the gym once won't give you rock hard abs. So going for once a week, for every 5 weeks, you start seeing results by week 3. And that's when you kind of start seeing. You may feel better depending on, everyone's different. You may feel better after the first treatment, but the difference is here is that it may not last and it's going to come back. So that's why we want to be consistent with it at the beginning. And then by week 5, we adjust and reevaluate. So coming every 2 weeks, once a month, or we continue with the weekly, but that's usually my rule of thumb. Okay, so another question I ask, who can get acupuncture? Can kids get acupuncture, and how can they benefit? So that is a very common question. So actually acupuncture, we can safely treat all ages, from newborns until the elderly, safely. So there's a lot of things that acupuncture is really good for kids, mainly because kids are very open. They don't have all the stress of life kind of that us adults do or teenagers do. So that's why kids tend to respond way more quickly than adults do. So meaning that kids can come in once a month for a treatment and they already do see the results very quickly. So some things that are really good for kids that they do come in for acupuncture for, I've seen a couple kids myself, nightmares, colic, digestive issues, ADHD, concentration on that same end there. Yeah, just anything really is really good for kids. And then we have all alternative forms of treatment for them. Kids, needles aren't always like, oh yay, needles. So we do have different forms. So we have little tacks that are like little stickers that we just put in and out. We have tinier needles that are good for the older kids who are probably around 8 or 9 that we can easily put in. And again, they're very small. And also if they're really against the needles, other alternative forms of treatment we can do acupressure, which is just pressing on the points to activate them, clean out, which is very good for digestive issues, and that just helps. It's a Chinese form of massage where we really just are able to stimulate certain aspects and meridians and channels. And yeah, and cupping also is something that adults are very familiar with, and it seems like very common, and we can also do that on children also. What are the benefits of acupuncture? Honestly, what isn't it good for? Acupuncture treats so many things, and I think people aren't aware of that, just because when people think of acupuncture, they think of pain, really, like muscle pain, which it is very good for. Chronic or acute, it can be good for any muscle pain, low back pain, neck pain, knee pain, and it is. But I think not many people are aware of the other benefits. So other benefits of acupuncture include anxiety, depression, and stress, which is a very common thing that people do come in for, and it is one of my favorite things to treat. It is also good for anything women's health related, and that is menstrual pain, irregular menstruation, infertility, and prenatal, and that's very safe also. And it's also good for cosmetics and asthma, as well as in children, and allergies, and honestly, there's so much more, but those are like the main common ones that people do come in for. And yeah. Okay, so this next section is on contraindications. Big word. So contraindication basically means big no-nos, what we don't do in acupuncture. So, but the thing is with acupuncture is very beneficial for all people, but the types of contraindications we have are relative. So it's in terms of points that we can and can't do depending on the person, such as in pregnancy. There is certain points that we avoid at the early stages of pregnancy, so first and second trimester, because they do induce labor. But the opposite side of that is we would do them if we're trying to induce, but that is a different section, and we'll get back to that afterwards. So there's also points that if, depending on people and what medications they're on, if people are on blood thinners, we provide extra caution in terms of needling, just because acupuncture is needling of something, and then there is possibility of bruising. So that's just something that we wouldn't use as much needles, kind of thing. We basically, in relative contraindications, it would depend on the person and their chief complaint, the reason for coming in, and their whole body in general and their whole constitution, and that's how we would kind of have that conversation on our first treatment. That's what the extra 25 minutes are for, and yeah, and then we kind of reevaluate, come up with a treatment plan that suits the patient best, and in order they have a safe, comfortable, and relaxing treatment. Okay, so here's a common misconception, that dry needling and acupuncture are the same. Ask any acupuncturist, this is one of our many issues that we face in clinics, where we kind of get, oh, like dry needling, I received acupuncture, but in fact it was dry needling. So dry needling has its own set of benefits, and it is great. So dry needling, the main difference between them two, dry needling is mainly treated by a physio, done by a physio or a chiropractor. And then it is really good for muscle tension, and then they needle trigger points, and then they stimulate them really hard, where it's mostly it's not a relaxing experience. It tends to be on the more painful side. Whereas acupuncture, what we do is we choose specific points where we do the needling, and in order to strengthen, and we do the same thing, we do needle trigger points, but the execution is very different. It's not meant to be painful. We may be uncomfortable for a moment, but we don't do that extra stimulation. What we may do is add it's kind of like a TENS machine, we may do electroacupuncture, but it's not painful as dry needling is. And a major difference also is that dry needling, what the schooling is at, the training is done for a minimum of 24 hours, I think, but in an acupuncture you need to go to an accredited school and get your diploma and get your degree to become registered. So dry needling tends to fall under the scope of a physio or a chiro, and acupuncture is school for at least 2 years. Okay, so prenatal acupuncture. A common misconception is that acupuncture isn't safe during pregnancy. So this is absolutely not true, so debunk that. Acupuncture is very useful during pregnancy, actually, and it has like a very good good strategic way in your first, second, and third trimesters on when to best and how treatments can really benefit you. So, like, for example, in your first trimester, acupuncture once a week is really beneficial, and that really helps with threatened miscarriage if you prevent any losses, and also nausea and any fatigue and pain. But nausea is a big one. And then in your second trimester, this is where you want to do acupuncture once a month, and that really helps with round ligament pain, any cramping, diarrhea, digestion, that whole issue there. Pain, any hip, back, muscle pain, which we could definitely do for. And then there is the third trimester, which is where we would go back to once a week starting at 35 and 36 weeks. So this is also really good for everything I mentioned. And again, this is also the time where we're going to start preparing your body for labor, so you can have a easier labor kind of thing. So we would start labor prep at 36, 37 weeks. So this is where we would do all the points, because there are points that are contraindicated in prenatal and that do induce labor. But this is where the fun part is we would bring these points in and use them at this point at 36, 37 weeks to make for an easier labor and to prepare your body for that. Okay, so now what we're going to do is we're going to bring Kelly back in here, and we're going to do a little bit of a demo on her of the most common used points that I use in almost every treatment in acupuncture to really show what the experience is like in order to really get a good feel. Okay, so first I'm going to do with these needles here. These are meant for the face, and they're nice because they're a little pink. So we're going to do the really common point that I love to do to set the tone of the treatment is right in between the eyebrows right here, and it's really good for calming and relaxing. So I'm just going to pinch the skin here and then put the needle right in on an angle so it doesn't puncture anything, and voila. Okay, so now we're going to use more of the standard needles here. I'm going to do a point at the top of the head that is really good for grounding, very common point that I like to do. So we find that point by the apex of the ear, and we really just go above and right in the center, and we do it on an angle, so again, we're not puncturing anything. All right. And then another point I like to do is on the hands, and it's just really good for the immune system. So it's actually right here between the index and the thumb. Very good if you ever feel like you're getting a cold or anything. That's a really good point just to really just strengthen your immune system. And that's it.
All right, that's it for this episode of today's special. I want to thank Nagin for imparting us some wisdom on how acupuncture is very beneficial and not that scary. Perfect. All right, so hopefully you like this video, and if you liked it, please like the video itself. If you like the content, please subscribe to our channel. It really helps us out a lot. Thank you very much. See you next time, and listen to your body.